Hello everyone, I'm Dr. Adam London, Director of the Kent County Health Department. Today is August 26th and I'm here for our Health Department's weekly update. Here in Kent County, we're currently seeing 7,448 total cases diagnosed of COVID-19 during the duration of this pandemic. We're at a positivity rate right now of 1.8%. So that continues to be on the low side, where we'd like to see it, less than 2%. And we're seeing about 40 to 50 new cases diagnosed every day, which is a little bit higher than the number I reported last week, but we're still seeing a relatively low number of new cases reported every day. We're at 6,214 recoveries of those total 7,448 cases. Over 6,200 have recovered, and we're at 158 deaths in total here in Kent County, 4 within the last week. So we have had a bit of a rough week with deaths, but we're still seeing far fewer deaths as a rate this month than we've seen in previous months. So that's very positive. I want to say thank you to all of our school administrators and superintendents who've done a great job planning for how we get back to school in as safe of a way as possible and providing options for our families, virtual, in class, some hybrid situations, different schedules being offered across the county in different districts. I know it's been frustrating for a lot of parents trying to understand all this new information and trying to get these plans as soon as possible. I just want you to know that our superintendents, the leaders in our school districts have really done a tremendous job. They've taken advantage of every moment possible to come up with the best plans, using the best tools and technology to make this school year as safe as possible, not just for the students and the faculty, but for all the families involved and for the communities in which they're located. And it's tough work. It really is. These are unprecedented times for all of us, and trying to do this difficult thing, which we know is so important. Educating our kids is such a huge priority for our community, but doing it in a way that is as safe as possible has been a huge undertaking for all of them, and they've done a lot of work, and we expect that we're going to see some successes. We also, to be honest, expect that we're going to see some setbacks. We're going to see cases, and we're going to respond to those in as quickly a manner as possible, and we're going to do everything we can to limit the size and the scope of those cases and those outbreaks when they do happen, so that we can continue with education and we can continue fighting this COVID-19 pandemic in a responsible way that serves all of our community. So great job to our school leaders, and great job to all of you, the families that are so important to our schools. Together, we're going to make sure that this school year happens, and it happens in a way that is good for our kids and good for all of our community. I want to shift gears a little bit now. In fact, we've been talking a lot about COVID-19 over the course of the past 6 months. The Kent County Health Department is always doing much more than coronavirus, and we were very busy before COVID-19 arrived here in Kent County. So as we proceed with these weekly updates, I'm going to continue to add some more content on different topics that are important to the community. And right now, something that's very timely and important for everyone are mosquito-borne illnesses. And we've talked a lot about West Nile virus in the past, and last year we talked a lot about Eastern equine encephalitis, or triple E as it's known. These are mosquito-borne illnesses, and they're illnesses that tend to be more prevalent in the late summer. And that's because these viruses that cause the illnesses, they amplify over the course of the year as they're spread back and forth between mosquitoes and their host organisms. And by the time late summer comes, we often see virus levels in the mosquitoes that are high enough to cause infection in people. And so that's why as late August comes along in September, up until about the time that we have our first frost, we're going to really encourage people to do what you can to avoid mosquito bites. Using DEET repellent, trying to avoid those times of the day where mosquitoes are the most active are important in trying to keep the prevalence of those illnesses as low as possible. And one other thing, I'm going to give everyone a little bit of homework today. Take a walk outside. Look in the bushes, look under the porch, look for any small containers. Maybe it's pop can, maybe it's a Frisbee under the porch, maybe it's the the little kiddie swimming pool that was used earlier this summer, but maybe it's been sitting vacant or unused for a while. Maybe it's the bird bath or the dog's dish. All of these small containers of water that have been sitting stagnant for a few weeks, those are great nurseries for mosquitoes. So look for those items, dump them out, get rid of them, put them someplace where they can't continue to accumulate water. By doing that, you can reduce the mosquito population around your yard by maybe hundreds of mosquitoes. And that's one way, one really simple, inexpensive way that we can reduce the risk of West Nile virus and EEE around our homes. So with that, I just encourage you to stay positive, stay heroic, and stay healthy, and I'll talk to you again next week. Thank you.